Sagi,
Here.
Nelson,
Here.
Nyman,
Here.
Benjelink, Bush, Diebald,
Here.
Vaughn,
Here.
Potter,
Here.
Taylor.
Here. Would you join me?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have no additions or deletions tonight.
Motion to approve the agenda.
Support.
We have a motion and support. All in favor, say aye.
Aye.
Opposed, motion passes. Agenda is approved. We have no letter of recognition, so we'll do presentations. And we have Gary, Candy, welcome, Candy.
Hi, everyone.
Hello.
Good to see everyone again. Last year was my first year in front of you all, and I'm happy to be back. Today I'm going to be going over our annual report for fiscal 25, so that is in your packet. I'm not sure what page, but our pages are numbered down in the lower right, so those are the numbers I'll be referring to as I go through. As you know, we're a private nonprofit organization. We've been around for 50 years in the communities up here. 10 counties is our service area, and Oxford is one of those. We have a board of directors, as you know, and Erin Robertson is here today. She is a member of our board of directors and we work for our service. And also we work very closely with the Active Council on Aging and lots of different things, and with contractual partners too for providing services and programs for older adults. So that said, on page 1, there's just our financial summary. You can see the numbers there. Page 2, we have our contracted services. So you can see Wexford County Council on Aging is listed as one of our contracted providers of services. One of the main ones, and right now, Wexford was the only county that we had in our service area with an adult day program for a few years now, and just recently won their opening one in Antrim County. But what a value to this community to have one right here, and it's really shows that ability to have one in each of the counties that we serve. So we feel that we are all very fortunate, and we're happy to be able to support our operations through our organization as well. One of the biggest programs that we have is the nutrition program. That has not changed for many, many years. The numbers keep going up. Over 567,000 meals in this region in the course of a year. Those are both congregate and home delivered meals. Congregate are the ones that are in senior centers and schools and churches and all those things. So they provide a great opportunity for connection and reducing social isolation. So I'll move on to page 3. Page 3 is, these are some programs that we provide directly, and I mentioned them last year too. Care management and the Medicaid My Choice waiver programs. Those programs are where we have nurses and social workers that go into the homes to help coordinate the services and set them up with local providers like the Council on Aging. So we're not duplicating services, we're out there working together. We do the assessments and they go in and provide hands-on care. And so just in last year, through those direct programs that help keep people at home to age in place instead of nursing facilities, we served 672. To me, that's just a number, really. When I think about it, I think of the people that represent that number, and 670 people that were able to live at home and age in place where they wanted to be, instead of being in an adult foster care or assisted living or nursing home. So that's what I see really when I look at that number. And we know that that number is not big enough. And what I mean is there's so many people out in our communities that need help and support. We're constantly struggling to figure out how do we reach them? How do we tell them about us? In partnership with the COA, how do we get ourselves out there so people can reach out? So it's ongoing, and if you have any advice or guidance, I'd love to take it. On the next page, page 4, there are our services and for those 2 programs. And you can see the numbers, again, lots of numbers, but I want you to think about the people that are being served behind those numbers. One of the things that I didn't report on last year was transportation. And so I know that you have a great public transportation system here in Wexford County. Not all the counties that we serve do. But regardless, for our Medicaid My Choice Waiver Program, if somebody needs to have non-emergent medical transportation to go to a specialist for their any type of medical appointment, regardless if it's in this area or downstate, the program pays for their transportation. And so last year was in the tune of $140,000. I thought that was important to mention because as we look at access to care and barriers, transportation is one of the top. We wish we could do more, but that's at least a start for us. And we know that there's a lot of local providers looking at that issue also. But again, you guys have a great transit to the public. On page 5, there's more of our community programs. So we have an information and assistance fund that's managed by our social workers. The COA does fantastic with taking calls and referrals and doing that similar type of work. What happens is, most often we find that people are calling the Wexford COA, but if they happen to call our office in Traverse, we do the referrals back to the local community. And so it's nice to be able to do that. There's some things, programs that we offer that they don't and vice versa. But that's the phone line, and last year there were over 7,800 contacts, people calling our office or emailing us. So we manage a lot of those. We do some elder abuse prevention. Housing assistance, that's really meant for those that are on the My Choice Medicaid Waiver Program that want to get services in their home instead of a nursing facility. So it's not housing assistance in the broad sense, but it's a very important program. We were able to serve 196 people last year. So for example, if someone was going to lose their home and that's where they were getting services, how do we find another place for them to live without having to go into a facility? Or if they've been in a rehab, and now they're moving back home where it is all housing, secure and housing. And so that's the focus of our housing support. We also help with Medicaid approvals for the long-term care services. It's not community Medicaid, it's just to pay for long-term care. We have a couple specialists, and so you can see the numbers there again, but I see value when I see those numbers and how we were able to help so many people. On page 6, we have our long-term care ombudsman program. That's where we have now this year 2 ombudsmen. An ombudsman, I think I shared last year, they go into the nursing facilities, licensed facilities, and they help work with residents to make sure their rights are being honored, and their dignity and their choices. And so our person goes in, works with the staff, works with the families and the residents. So it's a very important program. These numbers reflect just one staff person, and so that person was very, very busy. 280 facility visits, over 1,000 information and assistance contacts, and you can see the rest. But what I want to point out is we did get funding and do a lot of advocacy. We did hire that second person I mentioned last year. They're not reflected in this number because we got them onboarded in late summer, and then they had to get up to speed. So they are now, and I anticipate next year when they come here, those numbers will go up quite a bit. And her focus will be in assisted living and adult foster care. Where our previous person, and still existing person, was doing just nursing homes. So we've been able to expand. Yeah. And then under Medicare assistance counseling, the COA does a fantastic program for Medicare counseling, one of the biggest in this region, if not the biggest. They do a fantastic job. Our role in the Medicare counseling space is that we help coordinate the volunteers, the background checks, the onboarding. They do that with the COA too, but we partner to be able to do that. And then by our partnership, we're also able to offer the ongoing education and training for the Medicare program and the volunteers. So what you see in this report, the 414 client contacts on the bottom of page 6, that's just our 2 staff part-time and what they were able to accomplish in terms of helping people with enrollment, eligibility questions, and things like that. The local COAs that have the Medicare programs like Wexford, they are able to expand that reach, and I don't even know what their numbers are, but I know that they're marvelous. So that's my report, but I would love to just share just a couple more things and then ask for your thoughts on something too, if I may. One of the things is we have an advisory council in addition to our board of directors. And as I mentioned, Aaron's on our board of directors. Our advisory council, their role is different. It's not policy and budget necessarily. They help us with advocacy, so when we help with the needs are of the older adults and caregivers. They help us review the grant proposals every 2 years through the RFP process. They help us with our strategic plan every 3 years. And we meet once a month, I think 7 times a year, 8 times a year, virtually. If you know of anybody that would be interested in serving on our advisory council, we do not have a representative from Wexford County right now, and we haven't in a couple of years. We would love to have someone. Feel free to reach out to me or to reach out to Georgie or Aaron and pass names along. We provide that really. Thank you. And then the last thing I want to mention is I know that you have on your consent calendar today the local match. And I wanted to acknowledge that, again, it's very much appreciated. It's just to share with you a little bit, that match dollar, what it does. County funding, as you know, for us anyways, it's not simply supporting the area agency on aging, it's leveraging federal and state dollars so that we can return more money to the local residents in the community. And it helps us, so that local dollars is what it looks like, our meals, caregiver support, Medicare, counseling, daycare, all of those things. And for us, like an organization like the Area Agency on Aging, those county contributions are particularly important to help satisfy our required match. And you know that, but I just can't emphasize enough, it helps us to access millions of dollars that come back into the community. So what that looks like for Wexford County as of last year, through funneling, I call it kind of a pass-through, but through our partnerships and our agreements with Wexford COA and other providers in this area, $2.89 million was brought into the Wexford County because we're able to pull that match down and it will approve. So it allowed us to bring in $2.89 million. And the match, I think last year was $4,100. This year is $62.97. And just to give you the reason why it did go up a little bit is because we hadn't updated our funding formula since 2012. So it was a population based and then also grant based. So our board was looking at it, like it's been 14 years, we should probably update that. So that's the reason that everybody was wondering. That's all I have for you.
Any questions?
I have a question. You talked about your medical transportation and providing that. Are you affiliated with the Freedom then, or are you separate completely?
We don't do transportation. That's a great question. We don't do transportation directly, we fund it. So if we have a participant in the MySwiss program and they need to see a medical specialist downstate, we work with a local transportation provider to take them on that trip. And depending on what county they live in, we partner with whoever in that county that does that type of transportation. Like BOC County, they have volunteers that do some of that. I do sit on the Freedom Riders, and then Lex Express, they have a monthly meeting that I'm on that also. Yeah.
So that's where that goes. You don't have your own.
No, we do not.
That's where I understand. Thank you.
Yeah, thank you.
Any other questions?
What did you have the virtual meetings?
Our virtual meetings for the advisory are the second Thursday of every month at 10 a.m. We love in person, but it's always a virtual option. We have three openings, Wexford is one, and then also Emmett County and there's one other county that I'm missing right now, but we'd love to have someone.
Any other questions? Thank you very much.
I do have one question. I see in here that, about foster care homes, if they have complaints, says that you guys, my understanding is you guys look into those complaints. If they're AFC homes that are also have mental health clients, does the Office of Recipient Rights do that, or do you do that, or do you collaborate?
There's collaboration for sure. It depends on too, the age, because our ombudsman is 60 and older. And so for the other, it depending on the age of the others, yeah. And then it has to be a licensed facility. So there are some of those assisted living and foster care are not licensed by the state of Michigan. And if they're not licensed by the state, you can't get into them.
Anything else? Thank you very much.
Thank you.
Thank you.
We'll open the floor to public comments. And we will close public comment and consent agenda.
Motion to approve the consent agenda as amended, with Elena's name instead of Ashley's.
We have a motion and support. All in favor?
Aye.
Opposed? Motion passes. Move right into the agenda items. J1, Pivot Point Full and Service Agreement.
Motion to approve the Pivot Point full service and license agreement between the county and Pivot Point for a 12-month period, and the total annual cost of $3,364.75, and authorizes the board chairman to sign on behalf of the county. Support.
Motion and support, Joe.
So Pivot Point is a piece of software that several equalization departments are using across the state currently. And what that does, so currently when we go out and look at homes that have sold, we measure those homes, we sketch them, we take pictures, we bring them back, and we have to re-sketch in the system that we put them at. And we have to upload each picture individually to every parcel. Pivot Point, what it does is it, when we're on site, it geocodes those coordinates, and when we come back and connect to our main servers here at the county, it will upload those pictures automatically to the parcels that they actually go on. So it will be a big time saver for our office.
Anything else? Roll call, please.
Potter,
Yes.
Soggy,
Yes.
Nelson,
Yes.
Nyman,
Yes.
Benjelink,
Yes.
Theobald,
Yes.
Vaughn,
Yes.
Taylor.
Yes, motion passes 8-0. Agenda item J270, grant agreement.
Motion to approve the 270 Inc. grant agreement for the period of June 1st, 2026, to October 1st, 2026. The amount of $10,000, and authorize the board chairman to sign on behalf of the county.
Support. Motion and support. Any questions or discussion? Roll call, please.
Soggy,
Yes.
Nelson,
Yes.
Nyman,
Yes.
Benjelink,
Yes.
Theobald,
Yes.
Vaughn,
Yes.
Potter,
Yes.
Taylor.
Yes, the motion passes 8-0. Agenda item J3, fiscal year 2027 county match request.
Motion to approve the fiscal year 2027 county match request for area agency on aging in the amount of $6,297.
Motion and support. Any questions? Roll call, please.
Nelson,
Yes.
Nyman,
Yes.
Benjelink,
Yes.
Theobald,
Yes.
Vaughn,
Yes.
Potter,
Yes.
Soggy,
Yes.
Taylor.
Yes, motion passes 8-0. Agenda item J4, resolution 2620.
Motion to approve resolution 2026, so military for fiscal year 2026 budget.
Support. Motion and support, Joe.
So, maybe this is the third time I've presented to this board. So, it's something you do every year. You go through both the summer and the winter millage rates. Michigan law only allows the county to collect its operating millage in the summer. The rest of the millages have to be collected in the winter. This, as it starts out, I mean, our millage originally started out, our county allocated millage at 7.5 mils, which is $7.50 per $1,000 of taxable value. Over the years and after applying this year's Headley reduction fraction, that millage has been reduced to 6.4594 mils, or $6.45. So, just over $1 less per dollar per $1,000 of taxable value than was originally levied. That is the maximum amount that can be levied this year by this board.
It was 7 point.
It was 7.5 originally.
Any other questions? Roll call, please.
Nyman,
Yes.
Benjelink,
Yes.
Theobald,
Yes.
Vaughn,
Yes.
Potter,
Sure.
Soggy,
Yes.
Nelson,
Yes.
Taylor.
Yes, the motion passes 8-0. Agenda item J5, L 29 report.
Motion to approve the L 4029 report authorizing the clerk or chairman to sign on behalf of the county.
Support. Motion and support. Do you want to say anything, Joe?
No, this report just goes with it. It shows where we started out. It shows what our current year Headley reduction fraction is, and that I applied that before I presented it to this board. It also gives you the other millages and their year of expiration. So, we do know this board has already approved that the senior millage will be on the ballot to be renewed this year. It was good for 26, but it would have to be renewed next year, along with and I believe the transit authority millage is gonna be put on as well. even if they pay, those millages will be collected for 26. But by doing it this way, then those groups do not have to pay, and the county does not have to pay the additional money for an election outside of a normal election year.
Any other questions? Roll call.
Benjelink,
Yes.
Theobald,
Yes.
Bun,
Yes.
Potter,
Yes.
Soggy,
Yes.
Nelson,
Yes.
Nyman,
Yes.
Taylor.
Yes, motion passes 8-0. Agenda item J6, Ellen.
Motion to approve IP phone proposal and master service agreement approved by the county legal in the one-time fee of $1,875 and a monthly amount of $3,161.40 for a term of 36 months, and authorize the board chairman to sign on behalf of the county.
Motion and support. Want to say anything, Joe?
Just, this is for the new phone system that, Rec and Building and the board had asked us to look at. Since the cyber attack and even prior to that, we've been having issues with our current phone system going in and out. And this phone system is supposed to be much more stable and will make it much friendlier for the general public to get a hold of it.
Question? Roll call, please.
Theobald,
Yes.
Bun,
Yes.
Potter,
Yes.
Soggy,
Yes.
Nelson,
Yes.
Nyman,
Yes.
Benjelink,
Yes.
Taylor.
Yes, motion passes 8-0, and that ends the agenda item. Administrative report.
Yeah, don't have a lot, and, like I mentioned, lots more finalizing the audit, getting ready for our new budget calendar. Megan's been working on getting that put together. I have been fielding some phone calls, I don't know if anybody else has, I know Commissioner Nelson has, with regards to the Amish building that Mr. Mix brought up at the last meeting. But it sounded like, I've been talking to our building department, it sounds like there's some headway being made there. So I spoke to a gentleman on the phone today who had called and had some concerns, and he seemed very happy after we got off.
Any questions for Joe? Thank you. We have no correspondence, so we will open for public comment.
Evening, folks. I'm Luke Ryden. I'm here introducing myself as I run to be state representative of this district. Thank you guys for all your work, and I'm on my township planning commission, doing it for a while, and you guys got a lot done in a hurry. We might spend that time, and get almost nothing done. So, I'm impressed by that. Let me just take a minute. I'm a farmer. I have a contracting business as well in White Cloud, and I have a family, 5 kids. I've gotten no more involved in politics than serving on that commission until now. But as I looked around and I love the country, it was time to take a look at what's going on and be a part of it. So I've been enjoying that. You've probably seen a few signs around. I think I've hit about 1,000 doors in this Tri-County area, which is an hour and a half long. So I put a lot of miles on meeting people. The first thing I hear people talk about really at almost every door is just cost of living. So you guys are looking at property taxes, it's high on people's thought process these days. And you know, there's ideas going around about tax by tax and stuff, various things being suspected. For my part, I can't imagine how we would run a budget without property tax at this point. Certainly needs some looking at, and needs to be chopped down for many people, especially the seniors that are in danger of losing homes. And I think there's good argument to make for this, the uncapping of some of these seniors' homes so they can move to a smaller place, get those houses on the market for the families that need them, and they can move to those ranches with 2 bedrooms or something. That seems like a simple first step to start at. So property taxes on the radar there. I imagine you guys have also had a lot of conversations about AI centers and solar and some of these things. Everyone's trying to figure out how to put the brakes on in many cases. I think the real question is why is it put on gas? And I would be interested in seeing as a state, what we're subsidizing and why, and the degree to which we subsidize it, and maybe removing some of those subsidies that they were leading to these kinds of facilities being built on what the USGS would classify as prime farmland. And saying instead those subsidies could apply if they were developing brownfields, or maybe some very marginal land that didn't have experience with. As a farmer myself, I'm out of time.
Another time.
Thank you.
Thank you.
Dr. Carpenter, Cadillac, Michigan. Lois and I basically had lunch with Les Hausler and his sister Wendy the other day. I ran into him. He's alive and well, doing good. The conversation we had, oh my goodness, doing good, but no chemtrails in Wexford County, no data centers. Resolution would be great, you know, showing solidarity. We oppose this. Just recently acquired Don Jones's old Aerolite 103 that he wrecked. And I'm putting that back together. That's going to be so cool. So getting active again in aviation. Member of the Northern Lights, Chapter 678, experimental aviation in the Wexford County Airport. Anybody like to get active in the EAA, Chapter 678, get a hold of me. We can meet up and have meetings and put that plane together and go flying. A lot of fun. But just want to let you guys know, getting active in EAA again. Thank you.
Thank you, John. Not seeing anybody else come forward, we'll close public comment, liaison reports.
Bond.
None.
Potter.
Done?
Sagi. Nelson.
None.
Nyman. Benjalik.
Just real quick, I had a late session school board meeting a couple weeks ago. We meet every 3 months. And a little bit of good news for Lake Mitchell. At that time, our water was approximately 6 inches above the level. But as Mike Solomon told us, that is not a normal. That is normal. We've done that before. So right now, Lake Mitchell's looking great, and as far as I know, so is Big Cadillac. That was when Lake Mitchell board.
Theobald.
I attended Salvation Army, and I think instead of trying to go through this whole packet, I will try to email that out to everyone. There's how many families they've assisted for which programs and kind of that, and they're putting together bylaws and policies, procedures that they've never really had in place before. It was just what they've always done, so now they're trying to get it on paper. The other one is community corrections. They're looking to hire either a full-time employee to take Alex's position since she moved up into Misty's at a lower level. And they'll either get a full-time or 2 part-times, so they're trying to get through that. And my other one is a training that we went to in Grayling, and they were talking about our square footage that has been brought up a couple different times. The state is talking about bringing that to 500 square feet instead of the 800, so something to plan on watching, so. I think that's enough.
Taylor.
I attended the Veteran Service meeting, you at PSO doing a great job, and we're busy planning for the expo. Board comments.
Potter.
No, man?
Sagi.
Nope.
Nelson.
Nothing.
Nyman.
Nothing.
Benjalik. Theobald.
I'm not saying a word.
Bond.
I'm good.
Board chair.
Thank everybody for coming. Motion to adjourn. All in favor?
Aye.
Adjourn.
I have to let you go.
Yes.